They need to be using the social model, not the medical model. When professionals in positions of power are less educated on critical issues such as autism and care needs, the system becomes not only ineffective but also harmful. The result is a power imbalance that is frightening for unpaid carers who depend on these services for support. Addressing this imbalance requires a fundamental shift in how knowledge is generated, shared, and applied within these services. Systemic failures in risk management. The case study demonstrates a breakdown in the local council's risk management approach. Donna Schofield, a carer with 14 years of unpaid care experience, highlights the lack of adequate respite care, emergency support, and timely interventions for those caring for individuals with disabilities or chronic illnesses. This situation has led to her caring for her children for 20 hours a day, an unsustainable amount of time, which ultimately resulted in her breakdown. The CARES Act was established to protect unpaid carers from this exact situation. It sets forth provisions to ensure that carers receive the necessary support and respite, particularly in cases where care demands are excessive. However, despite these legal protections, the system failed Donna, leaving her unsupported until her condition worsened and she had to beg for support. A lack of effective communication and response from social services led to her feeling dismissed and invalidated. As a result, a preventable crisis escalated to the point where her autistic child required residential care, incurring significant costs to the Shetland Islands Council. The failure to intervene earlier demonstrates how inadequate risk management can result in higher financial costs for the council, alongside severe emotional trauma on carers and those they care for. Addressing financial and ethical considerations. Supporting unpaid carers is not just a moral obligation, it's a financial imperative for the council. Each unpaid care saves the Shetland Islands Council tens of thousands of pounds annually by providing care that would otherwise need to be covered by paid services. However, when unpaid carers are left unsupported and experience breakdowns, the financial burden is on the council. The financial burden on the council increases significantly as institutionalized care becomes necessary. A little bit of support that allows an unpaid carer to continue to care for free saves the council a lot of money. This case underscores the necessity of rethinking how resources are allocated. Care should be included in risk management planning, allowing services to be designed around their real lived experiences. Outcome number 9 in the strategic framework for supporting carers emphasizes the importance of using resources effectively. By integrating unpaid carers into decision-making processes, the council can ensure that resources are allocated efficiently and directed towards preventing crises before they occur. One of the core goals of health and social care systems is to enable individuals with disabilities such as autism to live independently at home with their families or their own homes. This aligns with outcome number 2, which focuses on keeping people in their communities and avoiding unnecessary institutionalization. Unpaid carers are the key that enables this goal. However, without proper support, they cannot sustain the level of care required to keep individuals with disabilities living independently. Caring for 20 hours a day is illegal, according to the CARES Act. This care should have been supported to at least be able to get some kind of break, to recover. This care should not have been just left to break down and then blamed for not being able to care for 20 hours a day. The Integration Board and the Shetland Islands Council must recognize the crucial role of unpaid carers and involve them in planning services. By doing so, they can better understand how to provide timely assistance and avoid costly outcomes such as this. Proper investment in respite care and emergency relief will prevent situations like this case study. where the carer was overwhelmed and the child was placed into residential care so she could recover, costing the council a significant amount of money. Unpaid carers saved Shetland Islands Council tens of thousands of pounds each. A little investment to allow them to continue to work for free saved the council a significant amount of money. If the council does not care about following the law, at least they should care about the money that is saved by supporting unpaid carers rather than letting them break down. Supporting carers through the third sector. Now that's where I come in. That's what I'm trying to achieve. I'm trying to fill the gap because I know there's not enough money. And I think my story proves the systemic failures. And with my story, I think I can raise a lot of money through the third sector because it proves Shetland Islands Council cannot even follow the law. That's how bad things are. Given the ongoing financial constraints faced by Shetland Islands Council, it's essential to explore additional avenues for supporting unpaid carers. The third sector, including nonprofit charities, organizations that can fill in the gaps left by public services. By partnering with these organizations, the council can provide more comprehensive support for carers, ensuring that they do not face these challenges alone, and ensuring that the council does not break the law. Here's my recommendations for improvement. To address the systemic issues outlined in this report, the following recommendations are proposed. 1. Enhance training for professionals. 2. Incorporate carers in planning. 3. Increased funding for respite care. 4. Strengthen communication channels. 5. Leverage the third sector. Conclusion. Unpaid carers are the backbone of the care system in Shetland, but their well-being is often overlooked. The case study presented in this report demonstrates the real-life consequences of inadequate support, poor risk management, and power imbalances existing within Shetland Islands Council. By making the necessary changes to training, resource allocation, and service design, the Shetland Islands Council can better protect the health and well-being of unpaid carers, save money, and protect themselves from being sued for breaking the CARES Act. Thank you.